We're going to start with essentials, chapter 5. So last week we talked about the peripheral nervous system. This week we're talking about, central nervous system. This week we're talking about peripheral. Yes.
We're going to come by and check homework after.
I can do that then.
This right here,
Shot in the dark.
yes, I literally was like, I try to Google and like try to like get better pictures and stuff like that. Nope. No, that's not part of it.
And I was like, I never really wanted to do something. Okay, I'm like, I know that there's something across the room because I can't figure this out. I kind of know I'm not dumb. So.
I know. I was like, I was not ready for this. I'm confused. I said, y'all, I have to show you this. I have 2 officers that still look out with me that help me with my homework. And I don't like it either. But like, it's not just fun, it's both of them. Like, they literally are up under me. It's a, like, they literally sit on me. Yeah, always. So I'm like sitting here with dog. Right there, you just understand. My husband comes out, and he's extremely smart. I was like, what are you doing? I was like, I'm trying to help. I said, do you know this? And he's just like, I haven't been in school in a while. He's a health physicist at America. And so I'm like, did you know these things? And he's like, wow, I love this. I'm like, because I have to. It's just Google it. I can't do it. Okay, this was night before last. Is this not the funniest thing ever? And
oh my God, that's hilarious.
is that not the greatest thing ever? That's our homework. That's our homework thing.
That's awesome.
So it's just like, I can't take it serious, but still. Yeah, he was mad up to me. He was just like, did you ever like songs we had in school?
You have anything else? Did you learn anything else? Some of your stuff. I'll bet I'm asking this word and that word. That's another title. I didn't look at all of your notes.
Yeah, I try to just load them all in that way.
Okay, well just put like all of these words.
Did mine come through?
I got Tappins and essentials. Did you put wellness with Tappins?
I did not. But I can redo it too.
Okay.
I'm sorry, I just put part 1 and part 2 because I was sending one.
Oh, no, you're fine.
I sent one from my phone and one from my computer.
I got it.
And that was the wheel and the year plan, right?
Mm-hmm.
Okay. So then there's the funds. I'm about to send you a picture of my dog. I'll try that, you know.
I don't know what subject to put that on.
So cute.
Wellness, I think?
I just realized I did not do the year plan part of the assessing your life balance.
I looked at your stuff 2 times trying to find it. I was like, oh,
That's
I'm
not-
sure it's here.
Apparently I did not do that. I am very sorry.
I figured you were into it in person.
And I can fill it out real quick, but.
Okay. Let's get going. Not anyone Monday. But Okay, so let's get started.
Excuse me.
It's okay.
Lisa called.
Your mouth got it.
Did.
Okay, so peripheral nervous system. We kind of already, we understand it's the limbs, everything that's outside of our trunk basically. But it has two divisions, somatic and visceral, which is also called autonomic. And those are kind of automatic. You don't have to think about those functions of your digestive glands, organs, blood vessels, and other membranes in the body. So ANS stands for autonomic nervous system. And it has a sympathetic, parasympathetic, and enteric parts. Sympathetic is our fight or flight, where we're afraid, we have fear. So it's going to cause excitement, increase blood pressure, all that kind of stuff, breathing rate. Parasympathetic is when we are relaxed, we're able to go back to normal, restore body functions and resources, get some nutrients. It says to think, rest, and digest. And the enteric nervous system controls our GI tract, digestion. Okay, so the basic function of our peripheral nervous system is to transmit messages to organs, sensory receptors in our skin or soft tissues, and then send whatever information that those tissues and glands give back to the brain or CNS. And that way it's like we're checking on each other to see, is any stimuli a threat? Do we need to do anything about it, or is it okay? So if it's a bee on our skin, that's a threat. If it's, our family member's hand, we can stay relaxed about it, for an example. Okay, so the peripheral nervous system is outside of the brain and spinal cord. It has nerves and ganglia, but they're not connected to the spine and spinal cord. There's 12 pairs of cranial nerves. That's important, and 31 pairs of spinal nerves. You do need to know that. Okay, nerves. A nerve is a bundle of the axons, the dendrites, or both. So any and all of those can be considered a nerve. If it is afferent, it's sensory, it's sending information to the brain or central nervous system. If it is motor information, impulses, that's called efferent. You need to be able to differentiate that. That's going from the brain to the body with instructions. So sensory information is coming from sensory nerves. Action or motor nerves. And then we have mixed nerves that have both afferent and efferent to organs or skin, for example, to the spinal cord. As pictured there on 135. So mixed has both sensory and motor fibers. If we have a group of nerve fibers, it's called a fasciculus. You'll see that again later. So first let's talk about cranial nerves. We have 12 pairs that come in and leave the cranium. They have olfactory, thalamus, visual cortex, and brainstem. And these are numbered. When you see them, they'll have, nerve 5 will have Roman numerals. Okay, and they just go by the way that they come in and out of the brain, and by sometimes to what their function is, like facial nerve, for example, is named for because it innervates the face. The 31 pairs of spinal nerves This is an example, picture 136 of the cranial nerves, and it has the Roman numerals table here on table 5.1 with the description of each nerve and its main functions. So the cranial nerve 1 deals with taste and smell. 2 deals with our vision. The third nerve is our eyes, controls our pupils for the light reactions. Cranial nerve 4 is about eye movement. 5 is the trigeminal nerve. It's the largest cranial nerve. It has 3 branches. One goes to the eye, the nasal cavity, and then the jaw. 6 has to do with lateral eye muscle movement. So our proprioceptor, our the peripheral vision. Our 7th cranial nerve has to do with tears and saliva, as well as facial expressions. The 8th carries impulses for hearing and sound to our vestibular area. Then we have nerve 9 has to deal with taste mostly. It can cause us to gag or swallow, create saliva too, if needed. 10 vagus nerves, so they control our muscles for speaking and swallowing, breathing, and heartbeat. 11 deals with mostly movement, so turning our head, shrugging our shoulders around. And 12 has to do with our tongue and throat movement. So do you have to have them memorized right now? No. Is it good to know some key ones, like which one is the largest? If you can remember in general, that will be helpful. Sometimes the books will ask you something like that. But again, you're not going to fail if you don't know. It'll be one question. So that's just a brief overview of our cranial nerves. And the vagus nerve is important because it helps with our development, and so it's very important. And if you deal with pre-pregnancy massage or pregnant clients, very important to be aware of where it's located and not put too much pressure on it.
What
during
did you
that
say?
stage. The vagus nerve?
Oh, that, okay.
Yeah, we'll go over that more as we cover that
Okay.
section. Spinal nerves, there's 31 pairs, so that means there's how many individual? 62. Okay, so again, we have mixed, they're all mixed nerves, so they have both sensory and motor information. So the ventral, which is on the anterior side, has our motor. It's going to send to or from the CNS. Motor information.
Say that again, sorry.
The ventral is our motor nerves, going to send information to or from the CNS. To tell you to shake that one.
Yeah, your family trait.
Motor nerves are going to go to or from the brain.
They're gonna go from the.
From, yes. Because otherwise, just the brain's doing a lot of movement and we can't really see that thing. Okay? The body is what does the movement. Okay. So ventral is anterior and it has motor. It's the motor nerve root. Dorsal is posterior. Remember, this is the dorsal side of the body. That might help. That is sensory. Don't know if this will be remembered, but we always want to move forward, right? So movement is on the anterior. Okay, move the anterior root. Sometimes it's something simple that clicks, sometimes not. Whatever works for you. If you guys have an idea, share it with the class. It might help someone else remember. Okay, spinal nerves also have a letter and a number to identify them with where they come out along the spinal cord. Just like, so we learn cervical, thoracic, lumbar, and sacral. So the nerves are numbered by which cervical, which thoracic, etc. that they're coming out of. A plexus, nerve plexus. This is a group of nerves that intersect. Most spinal nerves do converge into a plexi. And then they innervate a certain body area. So here we have C1 through 7. There's an eighth cranial nerve. And then we got T1 through 12, L1 through 5, S1 through 5. And the coccyx doesn't really have a nerve terminal. That should be, I don't know, is that around 7? Okay, so, because we have multiple nerves going toward body areas, that helps with preventing complete loss of function for that body area. Because C5 and 6 are going to go almost to the same area. So the whole section of the arm or the shoulder will not be impaired. Part of it, right? So that helps. And it's the same as we go along the body. Okay, so the names of the plexi. We have cervical plexus. This is 1 through most of C5. Okay, so this is head to upper shoulders, as well as a little bit of diaphragm motion. Brachial plexus from C5 to T1 comes out to the arms, or we call them upper limbs. And then if the ones that are below T1 that aren't in the brachial plexus, they're just here for the intercostals, the ribs, and breathing and stuff like that, or the skin. Then lumbar plexus, L1 to L4. So L5 is lumbar, but it's not in the lumbar plexus. So the ones that are different, remember that. Okay? And then L5 to S3 is in the sacral plexus. Everybody has a different number of fused sacral bones. It's from 3 to 5 bones. So they're all going to come out at S3. Everybody has an S3. Okay? And we'll learn more about those specifics when we go back to trail guide. Then we have dermatomes in just a second. Okay, so because we have multiple nerves innervating, it helps us not, of course, disrupt complete function, which, of course, if we have a complete severance on our spinal cord, we're going to lose complete function in certain areas of the body. Loss of feeling, loss of motion, and signals being sent. But an injury can cause it to not send it or be haphazard and send the wrong information. So when we have an injured nerve, that's when, and we'll study this more in pathology, you'll see a way going out of proportion response to very small stimulus or lack of response to a very big stimulus. So that's when the nervous system is not intact, right? So if you have, like we have power lines, right? They work great when they are not cut. If one gets half cut or has a tree hanging on it, it's not going to work. It might work okay, it might work on and off. It might start spraying sparks, right? Think of the nervous system like that, okay? So if you have a bone that starts pressing on the nerve, it may for a while work fine and you're not aware that the bone's pressing, but as soon as it presses enough to cause dysfunction of that nerve, you're either going to have pain, loss of sensation, right? Or loss of function of that area where that nerve is supposed to be sending its signals and receiving signals into the brain. And that's when we go looking for help, right? So usually there's been degeneration leading up to a point. We don't normally, unless it's like a car accident or you fall and break your back, you don't normally see the results of a nerve injury immediately. That's why it usually wakes them up at 3 in the morning with pain My carpal tunnel was going off. It was fine all day. It was slightly injured and you were working with it all day. And now you go to curl up and nope, too much pressure. So it takes time, and that's why. So you're like, I was just sleeping. Well, the injury happened earlier, possibly over many months of time. So we're going to always stretch and take care of ourselves so that we don't have those problems. Okay. So it lists on page 138 some more altered sensations and functioning, like hyperesia is decreased sensation. Hyper is going to be excessive. The numbness and tingling or burning in the nerve, that's called paresthesia. And then, of course, anesthesia is when we have complete loss of sensation. So numbness is not complete loss of sensation. It is headed there, but it still is getting some signal through, okay? Even though we know that it's not correct. And then injury to function, of course, it could be weakness, it could be twitching, or it could be being paralyzed. Now, dermatomes. A dermatome is a part of the skin that is supplied by one spinal nerve, okay? And this map nicely kind of shows us what it looks like, the relationship between any one nerve and the amount of skin that it innervates. So C2 is just here wrapped around the neck, on the side of the neck. C3 is in the front. C3 also comes down the arm, this little skinny part here. C8 is the medial side of the arm in anatomic position, coming down here through to the pinky. C7 is these two fingers and the upper part of the palm. So I lost feeling in my hand. A normal person is not going to think, oh, my nerve right here, my neck is injured. That must be the cause, right? But as we learn the body, we start knowing when someone tells us that they have numbness and tingling in their hand, the injury is up here. It's at the top of the line, right? The hose is kinked at the top. You're not going to get water at the bottom. Okay, it can be kinked anywhere in the line. So this is good to reference for later on as you continue learning about the body and its functions and dysfunctions. Yes, lumbar and sacral dysfunction affects the legs. And you know, the more you study, you can be able to differentiate what it is, if it's a herniated disc, if it's sciatica, based off of what they are telling you in their what information? Subjective. Very good. I know, it's quick fire. It's okay. There will be moments in class where I'm going to let him answer so I can get the quieter people down.
Sorry.
Okay. Myotone. Oh, and this is also how the Chinese meridians kind of work too. They do work along their pathways for the energy and reflexology. Myotome, last thing on 139, that is it's muscles that get their information from a single spinal nerve, a myotome. Okay, the next part we've all heard of reflexes before, right? We've had a doctor or somebody pop our knee and watch to see if it reacts with a kick. So it's just an involuntary action in response to a stimulus. So it can be created by reflexes involving the brain or not. Some is learned. If it's a learned response, like you learn if you see a red light to press the gas. Hopefully. Some people have a glitch in their on the brake. So it's a condition, right? You're not born thinking that red means stop, but you're taught that if you want to drive on the road, that's what you need to do. So So there's two types, simple and complex. Simple is going to be a natural response. Like if something is too hot, you naturally stop grabbing it or touching it. Okay? Conditions, like I just mentioned, is something that you have to learn. Okay? So simple natural reflexes is not involving the brain. It's body sensory. It doesn't have to go to the brain to be told to move your hand off of the hot iron or stove. Okay, so the brain is involved with conditioned, which are also called complex reflexes. And that's, we've all heard about the dog learning that the bell means it's going to get food, so saliva starts. That's learned conditioned. Okay, so there are reflex patterns that involve different types of stimuli. Somatosomatic is all sensory stimulus, and it's going to cause some somatic structure to respond. So whether it's the skin or the bone in the knee got hit and it caused that knee to move. So it's all sensory somatic on both ends. Somatovisceral reflex is a stimulus that's a somatic stimulus, whether it's on muscle, skeleton, tissue, organ, and then it's going to cause a response in that organ. So it could be, like at Denton's, you put ice on the skin. That's going to cause constriction to preserve. It's going to send the blood flow away from that immediate area. And of course, we all know that the body wants to keep the core warm the longest, so that's what happens when it's cold out. Viscerosomatic, a organ or gland is stimulated, whether it's by taking a pill or some kind of pain in the body, and then it's going to cause some kind of somatic reflex. So the stimulus is the first part of the word. The reflex, where that's happening, is the second part of the word. So somato or visceral. And visceral is a gland or an organ. And there's visceral too. So they look like confusing words, but just remember the first part is the stimuli is happening. The second part is where the reflex is happening. Okay. Somatic nervous system. This is dealing with the skin, muscles, joints, and bones. So it's information. If it's outside the body, it's external receptors. Something changed in the air, right? If cold wind blew, then that's going to cause either the eyes to close, shivering if it's really cold to simulate heat. Same thing with, if rain gets in your eye, or the beach, if salt water gets in your eye, you're going to close it as a natural reflexive response. Okay. Adaptation. Most of the time, we can train ourselves to condition ourselves to be aware of stimulus, to respond, right? If we respond naturally in a simple reflex and we get a negative response or, discipline of some sort or something we don't like, then we're going to learn. If we do that again, it happens again. Well, okay, so we got to have a different response. So for just very simple example, you want to get cookies. You're not supposed to have them before dinner. You get popped. So you learn to try to do it quietly so they don't catch you get the cookie, because you still want the cookie, right? But now you're trying to avoid the negative. So it's just something like that, simple. Okay, so the body is able to detect where our body is in space and if something is negative, like a pain. And it will adapt quickly. It doesn't take the brain very long to realize that something is painful, whether it is heat, cold, or pressure, or something's too fast. So we have receptors to detect all kinds of different stimuli so that the brain can respond as quick as possible. So mechanoreceptors on page 142, these detect changes in temperature, movement, pressure. Messner's corpuscles are touch receptors, basically, wherever we don't have hair. Okay, Ruffini's end organs, these are touch and pressure receptors where we have hair and where we have joints. Our free nerve endings have temperature receptors called thermal receptors. Anything dealing with temperature usually has a thermal related with it. Nociceptors deal with pain. They tell the brain that was pain. And proprioceptors are dealing with where our body's positioned and movement. Or propelling proprioceptors. So very important mechanical nociceptors, the free nerve endings, and proprioceptors. So where our body is, where the parts of the body are, where they're moving, all that is proprioception. Again, we're going to see the proprioceptors that we mentioned previously, the Golgi tendons that respond to tension changes, and the muscle spindles and the muscle bellies respond to a quick or a excessive amount of lengthening. And how does it do that? What is the response if it's going to lengthen too much? It slows it down. It feels the tension going, it's almost to the end point. That's when we're stretching. When we get to our normal limit, it naturally, slowly puts on a brake. You're going to have to force it to go past that point, right? You're going to need someone to help, or you're going to have to take it and push it. Okay. Reflex arcs. These are basically a pathway for a reflex to happen. From the impulse to the brain and back. So we have the receiver or receptor catches the sensory information, sends it up to the brain, and the brain sends back the instructions for the action. The reflex arc is basically just a pathway of the reflex from stimuli, brain, to action. 144. We have somatic reflexes that we deal with. Talk about briefly the stretch reflex, tendon reflex, flexor reflex, cross extensor reflex. So, stretch reflex basically is for protection. We don't want the muscles stretched too quickly so that will cause injury or trauma to the body, because that will be not homeostasis. Okay, so whenever you get to the impulse part, the muscle action potential of the nerve gets stimulated, and that automatically causes the muscle to start contracting to inhibit it from being overly stretched. The tendon reflex is a feedback control to let the muscle to relax. Okay, and the Golgi tendon is what identifies it and lets it release tension. So we want to stimulate that in most of our massage sessions, the tendon reflex. So when we're stretching someone, we want to communicate, right? And not go too fast, because then that will cause them to be tighter than before we stretch them, right? If somebody hasn't stretched in 5 years, and you're gonna try to make them do a split today on the table, they're going to come out hurting, not relaxed, right? That's an extreme example, but you get the point. We want to, so mostly you'll learn this, you're gonna learn how to help people to breathe for the most ideal stretch possible. They know what you're doing. They're gonna breathe a certain way, and you're gonna apply the stretch on a certain part of the breath so that it is ideal for relaxing the tissue that you're working with, as well as they're not concentrating completely on you. They're concentrating on their breath as you're telling them instructions. And it kind of lets the mind allow you to stretch in an ideal or optimal way. Flexor reflex. Basically, this is when something's painful or there's some kind of stimulus and it causes the muscles to contract, to withdraw, move away from the stimulus. So a flexor reflex is basically a withdrawal reflex. Right? Gonna touch it, pull that fine. Flex back. Crossed extensor reflex. This is, it works with the flexor reflex, and it's basically just, it will travel to the, what's the word I'm looking for? The other pair of muscles. So like bicep, tricep, right? We have the working muscle flexing, but this has to extend to allow this to flex because it's connected. So the cross extensor reflex, you're stimulating both because, okay, if I'm going to flex away quickly, I have to allow you to. We're going to work together. Okay, but mainly I want you to focus on stretch and tendon reflexes for the quiz purposes. All right. Look on page 146 in your box, practical application. Just want to highlight, it mentions that most benefits from archiving therapy come from resetting tension patterns. And so we can deliberately stimulate limbs on one side of the body that are going to affect other body parts on the opposite side. This is using the reflex patterns. And the body will have to readjust relating to postures and locations of how we're distorting it or not, or putting it back. And so it may get confused for a little bit because we're changing the pattern, but the result is it resets back into a better, efficient movement pattern. So we use these even if you're not thinking that you will. Okay, gamma motor neurons and muscle tone, 146. You need to know flaccid, flaccidity, hypotonic, hypertonic, which is spastic. If a muscle does not resist much, it's flaccid. And usually that will be from an injury to the nerve. If it offers a lot of the resistance when we're trying to apply a stretch, it's called spastic or hypertonic. It is staying overly toned and it is not accepting of a stretch. Okay, and this is very common with stroke individuals or people that have had an injury along their spinal cord. So that would be important if you're going to work with that kind of population where you're going to see like rehab facilities, PT, and sometimes chiropractic. You might see that too. Okay, so when we are it uses the example of stimulating skin on one side of the hand with pain. That's going to cause a quick withdrawal, right? If you go to get a cup of coffee in a mug and it's piping hot, you quickly withdraw that affects the opposite side. So this was tight, it's very loose, now the other side is tight quickly. Okay, so that's the body's adjusting. And also if you're leaning to pick it up, your body weight is on one leg, you quickly go back, a lot of things happen for you not to fall over. Core muscles, hip muscles, leg muscles, the gait cross from the hip and the shoulder to go away. So a lot of things are coordinated, and it can cause sometimes things to be adjusted in a not even way, right? If you're doing things like that a lot, you try to make quick movements to avoid injury, then that kind of person is going to need a lot of reset in their body, if that makes sense. And so, can you think of an example of a type of client you might see that, what kind of activities they'd be involved in, that you might see these patterns of non-optimal functioning that recur? Adonis is not here for his client. He wants to go into sports medicine, right? He's going to see athletes. Very common, right? Basketball, football, they're doing quick movements all the time. And then they might get crashed into something hard, whether it's a body or the ground. So you're going to see a lot of muscle bundles and things and fascia tightened up over time, and it's going to cause pain syndromes. So, we'll keep working with that, but that's just one example of a type of client you could see. But somebody who does repetitive work that has to quickly, maybe a roofer or something, I don't know, because they're having to stay balanced with heavy weight, and then if they get off balance, they quickly have to catch something. They're going to have a lot of that too, just in a different way. So you'll start identifying that and other things that you could see commonly once you start putting it together. Okay, so maintenance of our body's environment is what the ANS does, because it controls our smooth muscles, which are where? Where are smooth muscles? You said where? Okay, that's a good guess. Remember we had the 3 types of muscle tissue? Striated, smooth, and something else. Cardiac. Smooth is in our internal organs, because we don't need them getting knotted up too much, right?
Yeah, but not, I didn't think of that.
It's okay. Most of our involuntary are striated. They have lines of fibers. Okay, so the ANS controls those, right? They're going to control our esophagus, our breathing, our digestive processes, and all the glands that are a part of them. And so it's going to send information to the most effective response to happen first when it's working right. And so it's involuntary, because we don't have to think about breathing, heartbeat. Please start making saliva so I can eat my cheeseburger for lunch, because I'm, only got 10 minutes to eat. I'm in the drive-thru and need this to happen. We don't have to turn that on. We have things that work for us automatically. So, but we do still have the sympathetic and the parasympathetic parts of it. So we know the sympathetic is when we're stressed, parasympathetic is when we're calming down, we're conserving energy, we can relax. So, most of our organs contain neurons from both parts, sympathetic and parasympathetic, and that's called dual innervation. It's the top of 147. That way, if we are sitting down in our PJs at home watching a movie, and we're eating popcorn or dinner or whatever, we're relaxed, we're not stressed. But then if you hear a crashing sound of your window or doors being broken into, your body can automatically turn off digestion so you can use all energy to escape or attack or whatever you need to do, right? We don't need that to take a long time. We don't need us to have to think to tell it that I need that energy right now. I'm not worried about congestion. I would like to be safe. So the body's made, and so ANS has both. So it can do it and it can quickly change. And so it's dual innervated for that purpose. And so moment to moment, it can change our blood pressure up or down according to what's needed for activity or relaxation, and position, because if we're holding ourselves in a weird position for some reason, we need to be more alert, so our blood pressure is going to be higher than if we're chilling on the couch. Okay, so there's all kind of reasons. The sympathetic is basically because of where it's located. It's called the thoracolumbar division. Just be able to recognize that's talking about the sympathetic side. And its main function is emergency response to increase heart rate, dilate our bronchial tubes for more oxygen, increase blood sugar so that we have energy for quick use. And again, that happens if it's real or imagined. Like, I have a friend that's deathly afraid of lizards. It doesn't matter how many times I tell her they don't even have teeth to bite you with. She gets stressed out. She's so upset and nervous about it. Whereas I'm looking at the same lizard going, it's fine. I can scare it by going like this. Okay? So, hey, welcome.
How you doing?
You know we talked about you, right?
Is that right?
Oh, yeah.
Oh, man. Hopefully good things, right?
It's pretty good.
Okay, that's good.
Okay. So, parasympathetic structure and function is referred to as our cranial sacral division. It's where we restore our body. It's where we conserve energy and where we can repair. Okay, and so that's where we get the relaxation response. And it is involved in calming our heart rate, constricting bronchial tubes to slow down our breathing. We don't need excessive oxygen levels. And it regulates our digestion. It causes our eyes to constrict so we have close vision. We don't need to be looking 1,000 miles away when we're just relaxing, because we're not concerned about anything. All these little details that the body does to help us have either protection or relaxation. Now, thinking about this in a Eastern-Western concept, the ANS is a good example of yin and yang, because we have both. We can stimulate and we're calm. And so there are acupressure points located along the organs that are innervated in the ANS. And so we're going to talk about some organs here briefly on page 152. But the fascial lines of the body and acupressure points do overlap, just like they do with the nervous system. Alright, so the last section of this chapter is talking about the basic senses of the body. Touch, hearing, vision, taste, and smell. We have 6 main sensory receptors in the skin. Free nerve endings are the root of our hair, plexi, Merkel's disc, Messner's corpuscles, which is very fine touches, super sensitive, like on our fingertips, our eyelids, our lips. We have different level of sensory reception there. Then we have Pacinian corpuscles, which is deep pressure receptors, and then Rufian, which is in the dermis. Okay, it's just for skin pressure and movement only. So it's what lets you know that your skin is being moved without looking, right? You're aware of it. So the central nervous system can interpret where the sensation is occurring and decide if it's okay, we're okay with it, or we need to run or fight it, right? We need to kill the mosquito, or fight the bee, or the hand on us is someone that we like, and so we leave it there. So we can stay relaxed or not. So the touch can be identified and quickly determined if it's good or bad. And if it's bad, what will happen with our nervous system, the ANS?
It's just me.
Yes. So, Tiffany, is that going to cause our bronchioles to dilate or constrict? If it's bad and we don't like it, we're going to get rid of it. Dilate, yes. Take that big breath of air before we yell at them, right? Even if that's all we do. Okay? Good. So, the type of touch that we apply to someone is going to associate it with good or bad immediately. So the first touch that we do on someone, if we grab, right, if we go up and grab them, squeeze that trap, they're probably going to interpret that as positive or negative touch. Probably negative, and they're going to recoil with the reflex, right? Reflexive reflex. So we want to gently introduce ourselves into it. And that helps lower stress hormones, lower their stress and anxiety levels. It helps them be more accepting, helps them relax faster. Okay? Hearing, the second one. Hearing are just vibrations or energy that are recognized by our nervous system. Okay, so newborns quickly recognize sounds of their parents, so they've heard it already before they were born. And they associate that with safety, positive. So we don't want to yell at our clients in the room. Our cochlea, this is the true organ of hearing. It's called the organ of Forti, but the spiral shape is called the cochlea. Those are the two structures of hearing of importance. So the three main parts of our ear, we have external, middle, and inner. External is just made to help the sound get in to the middle ear so that it can be figured out what we're going to do with it, send it to the CNS for interpretation. The middle ear has little bones in it, 3 bones called the auditory ossicles, and they're called the malleus, the incus, and the stapes. Do you know that it has 3 bones that are called auditory ossicles? Bottom of 154. Then our inner ear has fluid, and that helps to change the vibrating sound into nerve signals that can be interpreted for the brain. Okay, and that also has to do with our balance. As we move around, fluid's going to move. There's little hairs in there to help direct the information of where our head is located. So the brain knows if our head is sideways, straight, or if we need to adjust it. Our brain likes our head parallel to the ground. Okay, so when we ride something and we're cooking, we don't just stay, we will adjust our head to be, the low riders, they don't drive like that. We gotta see. Okay, vision. is the sclera and cornea. The sclera is white, it keeps the shape and holds everything together. The middle has our ciliary, choroid, and iris. The choroid absorbs light, and vision happens when the light comes in the lens and goes onto the retina. Okay, of importance, know that rods deal with light and darkness on 156. And rods and cones can transform the signals into chemicals so that when they get sent to the optic nerve, the brain can decipher what are we seeing. Okay, so what hits the retina is what then gets transformed and sent to the optic nerve so that the brain can interpret it. Our cerebral cortex that we talked about last week is where these signals get organized and processed. Separates the information from both sides come together on the visual cortex. Okay, taste. We have many, but the 4 distinct ones are sweet, sour, salty, and bitter. We have on a general, an adult has over 10,000 taste buds. And there's receptor sites all in our mouth, on our tongue, on our cheeks, and on the floor of our mouth too. Not on the roof. Okay. Smell. Our smell centers are connected with our limbic system. That's why we have emotional associations with smells and behavior that goes with the emotions. Okay, that's why your ex's cologne doesn't make you have a great mood, right? Especially depending on how good or bad the breakup was. Can make you mad or sad. But grandma's dish makes you happy. Or whatever makes you happy. Good times. So there's chemical receptors in the roof of our nasal cavity. And so that's why the roof of our mouth is right under that. And so we don't have the taste receptors up there. We have chemical receptors in the nasal cavity. That's why our smell and our taste work together for us to taste. That's why when we're sick, when we're clogged, half of our system is not working well, we don't have a good sense of taste. Smell also, of course, is chemical signals that gets transmitted into electrical signals for our brain to be able to decipher. And the temporal lobe, that's where smell gets interpreted in the brain. And that is it for chapter 5. Okay, so real briefly, you know what a nerve is. You need to know how many pairs of nerves you have, cranial and spinal. You know what a plexus is. You need to know what injury could cause, what kind of sensations or functional injuries could cause. What's a dermatome, a biotone, reflex arc, conditioned or simple, the differences of that. Be able to identify the meaning of the reflex patterns. When we talked about somato and visceral, first and second part of the word tells you where the stimulus or the effect happens. The different types of mechanical receptors, 42 and 43. Reflex arc, stretch and tendon reflex. The main function of the PNS and its 2 divisions of sympathetic, parasympathetic. And basically on the sensitives, those things that I highlighted, the main stuff on the little details. All right, so that's anatomy for this week.